I never ever meet anyone this positive about anything.
I love it. I genuinely love it.
Okay, so hi everyone. Very exciting video for you today. We are at, what is this building called?
The Curzon building at Birmingham City University.
We're in the middle of Birmingham. I have absolutely no idea where we are. But I'm here today with the lovely Claire Carmichael, the third year nursing student.
Yeah, so I am coming to the end of my third and final year of nursing. I've got 10 weeks left and then I'm qualified. Or finished, I just got to wait for my pin.
Very exciting.
Yeah.
So you run a blog about your kind of student nursing adventures. Where can they find that?
So I've got my online blog, which is www.diaryofthestudentnurse.co.uk.
Definitely go and have a read. To Claire, I think you do similar content.
Yeah,
basically, we do similar things, but yours is nursing focused. And I feel like most med students, including myself, know woefully little about exactly what it is that nursing students and nurses do.
Yeah.
So basically, we did this collaboration. You guys have sent in a load of questions, which I have very helpfully here. They're not in any particular order. I've just written them down as they've come in, so we might cross over. But the first one, if you're happy to go, is what's a nursing associate? Which is probably not really.
Oh my God. Sorry.
Enjoy that one.
Nurses out there will be laughing with me. I don't mean to laugh, but this is a really common question.
Okay.
So this role was developed by the Nursing Midwifery Council because clearly there's a massive shortage in nurses. We see it in the news and everything. So they needed to do more. They needed to do something fast to fill in the gaps, basically. And a nursing associate is that midway point. So they're classed as a band 4. Mm-hmm. So it's in between a healthcare assistant and a nurse. So they do both jobs, pretty much, almost. Okay. So they'll do the personal care side, so the personal hygiene, washing, dressing, all of that of patients. But they'll also have responsibilities that are sort of taken from nurses, so they can give medications.
Okay.
I think they can do IVs, don't quote me on that. They can remove cannulas, they can do catheters, they can do wound care, they can do quite a lot that we nurses do as well.
Okay.
And to be honest, this is my own opinion now. I see nursing associates as basically there's mass shortage across the NHS. There's shortage in doctors, shortage in nursing, shortage of HCAs, and I think the responsibilities sort of being passed down. So I think nurses are becoming more responsible and doing a little bit more maybe doctoring stuff. I don't want to offend anybody.
Those sorts of, there's definitely a lot of overlap.
Yeah, and then so there's that overlap. So then they're giving some of our duties down to the new nursing associates. And then healthcare assistants are just amazing and doing everything. But the nursing associates are basically just that midway. They're not a registered nurse, but they are registered to the NMC, so they are accountable.
That's interesting, because what it makes me think of is, obviously there's physician associates. I can't think who physician associates are registered with. I think it's one of the colleges. But it sounds
Royal
similar.
College of Physicians.
Maybe. I honestly don't know. I should know, but I don't. But it sounds, like
it sounds similar,
So similar overlap.
That's a good point.
Cool. Okay, so this is a bit more of a straightforward question. Why did you choose nursing school over medical school, if you ever thought about going to medical school, which...
There's a simple answer to this. I didn't feel smart enough.
Med students are idiots.
I know, and you must hear this all the time. But for me, I didn't think I was smart enough to be a nurse, let alone a doctor. I didn't even think about, we were discussing earlier, about how we didn't think about different roles. I knew that I wanted to be a nurse. I didn't think about being a doctor. But I didn't do very well in GCSEs. I pretty much got D's and E's. So that really knocked my confidence, and I didn't think I would be smart enough for anything. And then it wasn't until I worked in a care home for the elderly that I fell in love with nursing. And I thought back to my childhood as well, when I came into contact with district nurses and stuff. And I thought, actually, yeah, maybe I could be a nurse. And then so I looked into it more, what I needed to do, how I could become a nurse, and got into it that way.
Here you are.
And here I am. And for me as well, with nursing, I feel like we have a lot more time with our patients than you do. I mean, there's no time anyway, but I feel like doctors, you've got so many patients to see, whereas we've got maybe a little bit less than you guys. I don't know, how many patients do you have?
I think it definitely varies by you know, the type, but I think no one would argue that wasn't true, that nurses spend more time with the patients.
Yeah, don't want to offend anyone.
No, they obviously do.
But we have like our own bays, we know the patient, we see the patient in, day out, and I feel like it's more hands-on, and I love it.
Great.
If I was going to be a doctor, it'd purely be for the title.
That's fair. I mean, I'm sure that's why many...
Dr. Carmichael.
There will be a substantial, maybe not substantial, but there will be a lot of people out there for which that is the reason. So here's a question.
Okay.
So say you hadn't got D's and E's, you had clean slate of A's everywhere, would you have applied for medical school?
I don't know.
No?
I don't know. I think because... I don't know.
Never thought about it.
I've never thought about that. That's a really good question. I think because I've always come into contact as well with nurses, they've been hands-on for me rather than doctors. I've never really thought about it.
It's funny, isn't it? How purely what you're exposed to does affect your worldview in that way. Do nursing students and nurses in general, is there a general perception of what medical students are like?
Oh. To be fair.
Do not mince your words.
To be fair, no. I can honestly say I've never heard a bad word about medical students. Maybe consultants and doctors, maybe, but not medical students.
That does surprise me.
Yeah. Or maybe it's just me just not listening to gossip and stuff, maybe, I don't know. But I've heard positive things. So I do my extra shifts in sexual health and family planning, and we get medic students and FY2s. And they are the best. The knowledge they're better than some of our consultants sometimes. Don't tell them I said that. And we've always had really good ones. There'll be one that's, there was one that was a bit there's one that almost treated a patient wrong and I had to intervene. But apart from that, I've honestly never heard not about medical students.
Okay.
In particular.
Fair. That genuinely really surprises me. But
I've never really thought about that since. Maybe I should ask when I go back.
Yeah, it would be
gauge a
interesting.
response.
I feel like we get in the way.
Oh, but then we probably feel that I do. I feel like as a student nurse, I get in the way sometimes.
But I meant even like of student nurses, because. We've done an interview for Claire's channel as well, and this is one of the things we talked about, where the way that I perceive student nurses when I see them on the wards is that they look very much like they know what they're doing and like how everything, and they're just occupied doing things, whereas we tend to like float. You know, I'm going to go speak to this patient, and then I might go and examine that one, not for any particular reason, but just because I can, or I might put a cannula in that person or do whatever. Whereas if we get under the feet of a nurse or a nursing student, it's like we're occupying a space so people have things to do. I've just reset the camera to give us a bit more time because this might be an emotive topic. What is the nursing bursary? And what are your thoughts on it being taken away? Well,
let me tell you. Firstly, I hate that it's been removed. Let's get that out of the way. But so the nursing bursary was completely funded by the NHS, where we got payments for being a student nurse, basically. So we would apply. They would go on by your employment, previous employment. So so for me, I was an independent person. I lived on my own. I wasn't married. I didn't live with my family. So they requested like 3 years of your wage slips to show that you're an independent person.
Okay.
You've funded yourself for the last 3 years. And then you get the maximum amount, which still was pennies. It's £460, I think I get a month.
It's barely rent, isn't it?
Literally, is my rent, almost. Well, just a bit over. So yeah, but they fund it differently. So if someone lives with their parents, they would get the bare minimum. They'd get, some people I've seen get £100, and that's it. But then we can also apply for the student loan as well. We don't get the 2 loans that you can get. We can only get the maintenance loan through the finance. And what I read, interestingly, was why they cut the bursary, mainly money issues, like it always is. But it was cheaper for them to just go through student finance. So because of the bursary and because of the student loan system, there was 2 different pots that they would have to keep open, I suppose, and I'm assuming that was a charge of some sort, and it cost the government a lot more to have those 2 open, so they closed the bursary and just done it through student finance, and to save money because they don't want to give us bursaries anymore. An assignment I did last year was talking about staff shortages, and part of that was the bursary, because I looked into the statistics with the UKCAT nursing applications and how the applicants have now dropped now that the bursary's been cut by 7%, I think it was, or something.
Okay.
It was quite a lot anyway. So since the bursary's been cut, there's been a decrease in applicants applying for nursing, and now it's not funded. You have to pay yourself, and nursing's completely different. I think it's completely different to, like we've been speaking about, medics, where we have to physically work on the ward. We don't just sit in a classroom here and there. We have to physically work 40-hour weeks, and I don't think you should pay yourself to work.
Yeah, that's a huge difference between medical school and nursing school that we've identified, is that the demands are very different, but in terms of physical, actual labour, nurses do, like, not I was going to say 100% more, but like hundreds of percentage points more. It's unbelievable. Yeah,
we work hard as student nurses, and I think that should be completely funded. However, on the plus side, I'm going to do a plus. So on the plus side is, like I said, I get the bursary, but it's pennies. So with the new, well, not new, it's the old, but so with the loan systems, students are getting a lot more now,
right,
even though they have to pay it back, but they're getting a lot more so they can survive a little bit better.
Right.
Which is the plus side. They just have to pay it back, which is really bad. But I think they should, have the course fees, whatever, pay the course fees like every other university degree. But I think they should pay you per placement.
Yeah, that's
that'd be good.
The thing, isn't it? You're paying to work.
Yeah.
Basically.
You have to pay yourself to work.
Yeah, it's mad.
But they should put something in place where they pay student nurses like a minimum wage or something to do their placements.
How would you feel that, like, I don't know whether this is in any way realistic, how would you feel if you would do your placements and they would then waive a certain amount of your loan payback, because obviously that wouldn't give you any immediate money back. Yeah, but
that's a good point.
But it shunts it into the future, doesn't it?
I'm not sure I'd like that.
No, I don't think I'd agree to that.
It'd be better than nothing, though.
yeah, which I suppose it is now. It's a difficult one. It's something a lot of people
they need to do something
to
bring nurses back in.
One of the questions that we got sent in, and I'd be really interested for your take on this. The question is, are med students too proud to provide personal care? We talked before, I had no idea what personal care actually meant, which doesn't bode very well, but we did get
But you know what personal care is now?
Yes.
We're teaching him well. So, no, I don't think at all. This is just my opinion. And I don't think it should be any other person's opinion either, that medics are too posh to wash. This is the quote that we get in nursing as well. HCAs, healthcare assistants, also say this about nurses: you're too posh to wash because physically haven't got time to wash a patient,
Right.
because their priorities is keeping the patient safe. You know, you've got the observations, you've got medications, you've got IVs, all of that sort of thing that have to take priority over a wash that isn't going to kill someone. If you don't wash that patient for the day, they're not going to die. But medications and things like that could impact on them.
Yeah.
And I think, like we were saying earlier again, it's your role is completely different to ours. It's not, I'm assuming it's not part of your job description. I wouldn't, if you're a healthcare assistant or nurse or anyone out there, you wouldn't go to, say, your receptionist and say, come and wash my patient, because that's not in their job description, that's not their role. There's different skills for different people, and your job's far more important than, oh God, don't kill me for saying that. Far more important.
The internet will play up.
Oh God, I'm so sorry, guys.
They're different.
We're always taught prioritise your patients.
Yeah.
You're prioritising the emergency needs of that patient and keeping them safe. And it's up to them if they want to wash or dress or not. It's up to them. But if someone needs that physical help to wash and dress, and they're not going to have a wash or get dressed because you haven't helped them, if I've got that, or if you've got that, let's just say you were given that task in your job description. If you've got that and say a patient just had a massive reaction to a medication, you're not going to be like, stop, I've got to wash the patient first. You're going to prioritise your other responsibilities over washing a patient.
Okay, so the next one is nursing school fulfilling?
Oh yeah, that's a nice one. It depends on who you ask. You're asking me, so I'm going to be like, yes, because I love life, I love nursing. It's amazing, and I've had nothing but an amazing journey throughout these 3 years. It's gone above and beyond all of my expectations, and I just love life. It's the best. But if you ask another student, they might not have the same experiences and they might not agree.
I never ever meet anyone this positive about anything.
I love it. I genuinely love it.
All medical students and virtually all doctors are incredibly jaded.
Send them to me. I'll give them some workshops on positivity.
Oh man.
Oh, but it does. There's something just so nice about caring for people and patients, and I just love it.
That's really nice. I mean, something I've kind of reflected on before but not spoken about in great depth, I'd be interested to know your take, is even as a student, and again it's difficult for you because you're on the verge of actually qualifying, do you feel like you're able to have a meaningful impact despite your lack of seniority, as it were?
Yeah, absolutely. And I think probably more so because as students we get a lot more time with our patients than when you're qualified, where you've got maybe 101 other things to do as well. As a student we can sort of take advantage of the fact that we're supernumerary, not in really theory, supernumerary, and we can spend a lot longer with patients, and it's just, I think we get a lot more time. Okay.
Yeah, that's not dissimilar for us, to be fair. If I wanted to spend an hour or half an hour whatever chatting to a patient, there's nothing that would stop me doing that.
And patients really need that. Like, they're sick, they're poorly, something's happened to them, and sometimes all they want is someone to just take it away, even if it's just that brief minute that you're speaking to them. And they'll always remember that kindness, I think, of you sitting and talking to them rather than being rushed and saying, sorry, I'm too busy. Or
that's very true.
And I think with wards as well, sorry, I'm on one now, it can be very routine on board. So you've got your certain times for certain things, very regimental. And but who says a patient has to be up, washed, dressed by 7 a.m? They've got all day. They're in your hospital. They're going to be staying overnight. They've got all day to have a wash and get dressed.
Yeah, nursing homes, that really hit me when I was there. Like that patient absolutely has no interest in being out of bed at 7. As you say, like, just let them be.
Yeah. If they want to stay in bed, let them stay in bed.
Do you feel that your course is well organised?
Ooh, that's interesting. Okay, so I think our course is structured really well. Organised, majority of the time, yes, but there are obviously timetabling issues. Sometimes there's placement issues. Things happen. It must be really, really hard, I think, because I always think about it from the other person's perspective as well. It must be hard for lecturers or whoever's in charge of room bookings to fit in however many hundreds of students. So there's going to be problems and things are going to happen, just like in real life. Things are going to happen when you're out there working on the wards or in the community, on an ambulance, wherever. And things don't go to plan. But overall, my course is really organised, it's really structured. And the way they've done it as well, it's been really good. So like we were saying earlier about in first year, we start with the body systems and get used to that, and then moving up in second year, and you sort of progress up, going in a bit more in depth with the physiology, medications and stuff. And just seeing that transitioning is really good. The way they've structured it so that happens is really good, and that's what I love.
Cool. That's something we haven't talked about, but I feel might be of interest, and I certainly don't really know anything about it. Mm-hmm. What's the training structure like for nurses? So you obviously, like with a med student, you have med student to junior doctor to reg to consultant or to GP. I never understand
any of that. So
when you qualify, you get your PIN.
Yeah. So at the minute, I'm a student nurse. So first year, we have stripes on our uniforms. We've got red for danger for first year. This is what I say, whether it's true or not, but I don't know. Then we've got second year, you get a navy blue stripe, and third year, you get another navy blue stripe. So you've got 3 stripes for each year. So first year, you're more direct contact with your mentor, being supervised constantly. You're not supposed to do anything without your mentor. Yeah. Second year, they give you a little bit of reins, sort of have you doing things but watching you from a distance, sort of giving you that bit more autonomy in a way. And then third year, it's your management sort of year, so you've got to prepare for being a newly qualified nurse, being autonomous and making decisions. So they sort of work it like that through the years. And then I'm a newly qualified nurse, so I'll be a band 5. And
so you go in at 5?
Go in at band 5, yeah. And that's what every newly qualified nurse starts. And then they've just brought in this preceptorship period, what they call. So you're a nurse, but you're still going to have a mentor in a way. So you're still being supervised so that it eases you in from being a student to a nurse, because a lot of nurses burn out, they get stressed and things like that. So I think they wanted to ease that bit.
Sure.
I think there's like a tick sheet, like a book or something that you have that you get signed to make sure that you're meeting all the criteria of a newly qualified nurse. And then you can go up to a band 6, which is, it depends where you are, where you work. So for us, I don't know if it's the same with medics, like on the ward, your band 5 is your staff nurse, and then your band 6 will be more a nurse in charge. They'll organise rotas and things like that.
So they're just a bit more senior, is
a bit more senior, yeah. Band 7, I can't remember what the band 7 does on the ward because you don't see them as much, sorry. I think they're more management, recruitment kind of. Don't kill me if I don't know it, I'm sorry. Whereas in the community, you'll have the band 5 nurse, band 6 nurse, which is kind of the same role. They'll do similar things, so they'll still see patients and everything. But the band 6 will be more the nurse in charge, again like the wards. But they'll organise the day, they'll take care of any problems. And then the band 7, again, sees patients, but she'll be managing all of the rotas and recruitment, sorting out any really challenging things, complaints, things like that. Yeah. And then the band 8 is more matron, so they are like the top dog.
I've heard that word.
the scary matrons. They're not scary.
They wear the hats?
Yeah. No, they don't wear hats anymore.
Oh.
I know. Bring back the hats. Health and safety or something, I think. But then the band 8 is usually a matron. They oversee absolutely everything. I'm assuming they do, I don't actually know what they do. I'm going to assume they do funding and costing as well.
Okay.
Ordering
like
and
admin-y type things.
Yeah, you very rarely see a matron on the ward. Sorry if you are a matron and you
It's
do
all new
care.
words to me.
I'm really sorry.
Do you have any advice, I should say, for medical students or even F1s starting their new placements on a ward?
First, don't look so scared. Don't doubt yourself, because you're brilliant and you can actually bring a lot to the team without even realising it. And you might not think it because you might get a bad reception when you arrive on a ward, but that's just the ward, I think. And because people are so stressed, again, I've said it 100 times, it's so short-staffed, people are so stressed and focused, they're not really thinking about new students or medics or anything coming in, they're so concentrated. But I think just be friendly, smile, speak to your nurses, get to know your nurses, and make the most of every opportunity. Like if there's something new that you haven't seen before, do it, see it. I'm quite a hands-on person, so I like to do things. So I'll never just sit back and watch. I'll be like, oh, can I do this? Can I do this? Obviously, if I'm competent and confident and been trained to do so. And yeah, take the time out to get to know your nurses. I think it'd be really nice.
That's good advice.
Yeah.
But then the other part to that was from a nursing perspective, what qualities do you and the team look for in your medics that come to you? Like what makes you think that person's
someone that knows what they're talking about, basically. Someone that's approachable as well. If you're looking all angry and stressed, then we're going to be a bit like, oh, I don't know whether to approach them.
Yeah.
Do I, don't I? What else? I think knowledge more than anything.
Yeah.
I'm going to go off on one again, aren't I?
We've
I've
got
only
time.
had one bad experience with the doctor. It wasn't a medic or a junior or anything. A fully trained doctor, very knowledgeable, been there years and years. And he made a very bad decision about a patient, which I didn't agree with.
Okay.
And for me, I was only a first year student there, so I'm not going to challenge a doctor.
Yeah.
Not a chance. So I went to my mentor and I said to my mentor, I really don't agree with this diagnosis. This patient is still in pain, still in agony, projectile vomiting bile across the ward.
Yeah.
And the doctor's telling me he's comfortable, query gastritis, but that doesn't, I'm not a doctor, but that doesn't look like gastritis to me. So she said, okay, we'll get a second opinion. And the doctor was wrong and that patient died that night. I know.
Grim.
But that was no fault of the doctors, I want to say that. The patient would have died either way.
Yeah.
But I lost my trust in that person then, because I thought, well, he hasn't helped that patient at all. He's come up with a completely wrong diagnosis. And I didn't go to them again. I went to the other doctor because there was a few doctors that come on the ward.
That seems fair.
Yeah.
You know.
And it's a sort of, and that's bad. It shouldn't happen, but.
But so here's the thing: the nurses can't they? You are well within your rights if you are given an instruction by a doctor, or a doctor says, you know, I think they've got X disease, and this is how I want you to treat them. And I want you to give them this. Yeah. You can turn around and say, no, I don't want to give them this.
Absolutely, yeah. And I think this is the thing, a lot of nurses think that they can't question things. Because you're with that patient 24/7, you know your patient, you know what they usually look like, you know their behaviours and everything. Whereas the doctor, they see the patient, but maybe they don't know the patient as well sometimes, no offence.
Well, that is true.
So I think sometimes our judgment can help the patient, I suppose. But nurses, you're well within your right to question a doctor professionally, not in a bad way. Professionally, politely, because you have to get on with doctors, you have to communicate, you have to the best outcome for your patient. But as part of the NMC code that is our Bible, Bible, we have to act as an advocate for our patient. Yeah. So that's against anybody. But saying that, you have to have a very good rationale of why you're questioning it. You have to back it up with evidence. You can't just say, oh, I think this and I think that. You have to back it up and say, I'm trying to think of an example now. I can't think of it.
I don't know, like it says, I don't think they're septic.
Yes, so they're not septic. Let's just give them this for a UTI. Which actually might work because maybe the root cause might have been a UTI. But then you can go to the doctor and say, well, no, have you looked at starting the sepsis 6 pathway? Because, you know, the oxygen levels have dropped, the BP has dropped below 90 as per the guidelines. So as long as you can rationalise why you're questioning it and get them to think a little bit more about other things, then you're okay.
Good. And it's really important.
But in a professional way, I have to say that. You can't go in all guns blazing, no, you're wrong, because that's not nice, that's not professional.
Well,
and you've got to work with them for the rest of the shift.
but it's good that the stopgaps are there for people no one's infallible.
Yeah.
So and it may be based on what people, even we were saying about what we're taught to look, I think, through very different lenses. Like, certainly if I see a patient for the first time and I'm doing my history, I'm thinking, you know, right, what are my top 5 differential diagnoses, and what questions am I going to ask to round this down, and what's the relevant anatomy and the ionic changes and, you know, the blood supply and all that involved. And it's like, well, they're just cold, you know, or the reason their SATs are so low is that the pulse ox isn't plugged in properly, or, you know, just things I think everyone has their own focus, and that's why the teams are so important.
And there's so many, I think, conditions that can look like other conditions. So as a doctor, it must be so hard. I don't envy you sometimes, because it must be really hard to diagnose a patient.
Well, no, I don't have to do it.
He's going to get there. He's going to be brilliant.
Do you feel valued as a nurse or a nursing student by the doctors? Do you feel that your role is understood by the medical staff that you work with?
That's a good one. It depends. It depends on the team. It depends on which setting you're in, community, wards. Because some doctors really do listen to you as a student and you feel valued, but then other doctors might not. Because some doctors I've gone to and I've said, oh, this, and this, and they've been like, oh, yeah, that's okay, I'll go and check the patient out, do some observations, blah, blah, blah. And other doctors are just went,
whatever.
You're just a student. What do you know? And then you have to go to them again and say, listen, I'm being serious now, there's a patient over there. Or I'll go to my mentor and be like, listen, I've asked the doctor to do this, it hasn't been done yet, can you just shimmy him along or her along? But yeah, I think overall I feel valued.
Good, okay.
Yeah, most doctors are very, very good.
Okay, that's good. I never know which way these are going to go, because there's just such a range of personalities across all the kind of different fields, aren't there? And I came into this thinking that you were going to tell me all these horror stories about like horrible surgeons and doctors and people, but thankfully
overall I've had a good experience.
Good, that's really pleasant to hear. The last one, which is something that I kind of gave my 2 cents on, you asked me the same question in your video, but this one is about relationships in nursing and medical school. So do people, obviously I think that the gist is it's a massively time demanding and quite emotionally intense course quite a lot of the time. So do people make it work, or does it kill relationships, or what's your take?
Like we were talking earlier, I think if your relationship's meant to be, it's meant to be, and you can work it out. I know nursing is intense, it's probably intense, or it's going to be intense for you as a medic as well. But if you've got an understanding partner who gets it, you're going to be all right. But at the same time, like as I was saying earlier with my questions with Ollie, I've seen a lot of relationships break down as well. So there'll be people on Facebook groups saying, I don't know what to do, I broke up with my husband.
That's a big one.
Yeah, the husband,
Yeah.
house, everything's gone. And it seems to be quite common in nursing, and I'm not too sure why. But then I've got a couple of friends who are happily married and it hasn't affected their life, sorry, poor English. Hasn't affected them, they're happily married, and I think if it's going to work, it's going to work.
Yeah.
But for me personally, in my own personal life, second year I had a breakup, but that wasn't because of nursing or anything like that. We weren't suited at all.
Yeah.
And my partner at the time didn't understand nursing or anything about it, and wasn't interested in anything, so it was a lot of reasons. It wasn't because of the course at all.
Yeah, it's same on my end. I know people that have done both. You know, we've had people get married during the course. Grad entry medicine, because people are a little bit older.
Yeah.
And that's great. And then some don't work out. Like my personal, I split up with my partner before coming.
Yeah.
That wasn't anything to do with the course. But yeah, if it's going to work, it's going to work.
Yeah.
And things, even if it doesn't work out, I guess, like, so what, ultimately? You
Life goes on.
Yeah, if you've made the choice that going to nursing school is what your priority is going to be, which is, the noblest of goals, sometimes I guess what it's going to have to be. There is also one more question that I've just remembered. I forgot. It's not on my list, but someone did ask me. So to conclude our questioning, who would look better in a sexy nursing outfit, me or you?
Ollie, obviously.
Of course. And that is all our questions.
Of course.
I felt bad not putting, the person was quite insistent.
No, it's really funny, great question.
Why has that become a thing?
But on that point, actually, a lot of people get very offended with the sexy nurse outfits and things. I've seen it's really common, especially on Twitter. People really hate it. I
thought you meant it was. Oh.
No, not in a good way, in a bad way. Sorry.
Yes.
No. I think nurses get very offended by it because they're like, we shouldn't just be seen as this sex object, blah, blah, blah. Sorry, no offence to anybody that I'm saying this to. But for me, I'm just like, it is what it is. Like, it's an outfit. I'm not bothered by it.
So for instance, many of you may have seen, if you go digging on social media profiles, we have a tradition at the medical school every year. Although this is a slightly different thing, but it's called Doctors and Nurses.
Okay.
And basically what happens is all the guys dress up as nurses.
Yeah.
Kind of the sexier the costume, the better.
Yeah.
Like everything in quotation marks. And then all the girls dress up as doctors, which obviously I realise raises another question.
Yeah.
But is that okay?
In my eyes, it's fine. I think it's hilarious. But people do get offended and they're like, we shouldn't be seen as these sort of objects. This is nursing, it's more than that. And our uniforms are horrendous. They're not sexy at all. Like, our trousers are up here.
The ones
horrendous.
That you see are not, like, I've never seen.
You don't look at someone and think, oh, that's nice. No. No. And we get blood on it, vomit
Where's
on
all
it.
the vomit?
Why would you want that? But yeah, people do get offended by it. And quite rightly, it's their opinion and things. And I think someone looked through GIFs as well on like if you type in nursing or nurse, it's all the sexy images that comes up. There's no normal nurse in a normal outfit, normal tunic, trousers, whatever, scrubs, whatever you wear.
Yeah, true.
But people do get very offended of it because we should be taken seriously as nurses.
Definitely. I think it's maintaining that consciousness, I suppose, isn't it? That I think I'm on a similar sort of page. I think it's funny. Like,
It's, yeah.
the litmus test would be, is there malice involved? And no, in 99% of
Yeah.
cases there won't be.
Yeah.
But yeah, nurses work insanely hard. It's honestly not. It's not something I could see myself doing.
Yeah.
Purely, and it's not a nice thing to say, but I don't think nurses are rewarded well enough for
No,
what they
Yeah.
do, and it's for that. That's one of the the main
Yeah,
reasons
that's
why I
true.
wouldn't, why it's kind of not on my list. But that's very selfish.
That's fair enough.
But we need to pay nurses more.
Do need more pay? Come on,
Like,
Boris.
oh God.
Get your finger out. Get your wallet out.
Right.
Put on your nurse's outfit.
He will. He will.
You probably would.
And on that horrific bombshell, I think
Anyway.
that's where we'll wrap it up.
Yes.
So, thank you so much, Claire.
Thanks, Ollie.
Sorting
It's been
out
great.
this
It's
lovely
been
room
great.
for us
It's
to film
alright.
in.
It's been good fun.
I've been taken on a mini tour of Birmingham.
We have, yeah. I'll show you around the uni after.
But if you've got any questions, comments, anything else that you want to put to Claire, you're on social media kind of
Yeah,
everywhere.
I'm on everything.
Is there a Facebook, Twitter? Like what's easiest?
Facebook, Twitter, Instagram.
We'll put links to everything
Yeah.
in the description to the video. But she does amazing stuff. Please go and support her on her channel, and I'm sure she'll be happy to sort them out.
Thanks. And thanks for all your questions. They've been hilarious and really good, really thought-provoking as well.
You outdid yourselves, guys. Thank
Thank you.
Take care. Bye.
Bye.